Before we get started, I'd like to read the disclaimer on your screen. The PharmAssist virtual learning experience brought to you by Mandel's Clinical Pharmacy is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. Now that we've gotten that out the way, I would like to welcome everyone tonight to the program. My name is Tony Newman. I'll be your host tonight. I've been a fertility nurse for 3 years. I work in the New Orleans area, and I'm very excited to be part of this education program with Mandel's. Thank you for tuning in to PharmAssist Virtual Learning Experience, an educational program created by Mandel's Clinical Pharmacy to bring you together with outstanding healthcare professionals right from the comfort of your own home. The PharmAssist program takes place every Monday at 7 p.m. Eastern. Tonight, we will be providing a live medication instructional program on 3 common fertility products: the Gonolf 75-unit vial, HCG, and progesterone and oil. This will include an interactive Q&A session throughout the program. Please join us via Zoom or Facebook Live, and we invite you to be part of this discussion by sharing your questions in either format. We encourage this to be an interactive discussion, so please don't be shy and ask away. We are joined by various amazing healthcare professionals each week from across the nation to provide you with a real-world experience, just as if you were sitting across from the table at them at the clinic. Today, we are joined by Kaitlyn Endicott, Women's Health Nurse Practitioner. Thank you again for your time and interest this evening. And I'm going to go ahead and turn it over to you, Kaitlyn.
Thanks, Tony. Hello, everyone. Thanks again for tuning in with us tonight. As Tony said, my name's Kaitlyn. I'm a nurse practitioner in the Northern Virginia area. I hope that tonight's videos help you to understand and gain confidence with injection administration. As Tony mentioned, tonight we will be discussing 3 different medications. So after each video, we will have time for a Q&A session. So you can type in any questions that come to mind while watching the videos as we go along. Please do keep in mind that I can answer general questions about the products and how they work, but I am unable to answer specific questions such as why you're on a certain medication or a certain dose of that given medication. Those types of questions I will defer back to you to ask your provider directly. So with that, I think we are ready to get started with our first medication, which is the Gonolf vial. So we are ready whenever you are, Tony. Instructions for the Gonolf multi-use vial. First, collect all of your supplies. So you will need your vial of medication. You will also need the pre-filled syringe that's full of saline or water. And you will also need one of the provided syringes. The medication will have a cap on it. It'll just pop off like this. You'll see the rubber stopper there. At this point, you can take your cap off of the pre-filled syringe. I recommend getting into the habit of taking an alcohol prep wipe to wipe off the rubber top of the vial. In order to compound the medication, you will just push your needle into the vial of medicine, inject all of the water into the vial. Once all of the water is in the vial, you can take out the syringe. It can go into your sharps container. And at this point, you have your medication reconstituted. Now you'll use this vial multiple times. So at this point, you can go ahead, take your syringe, peel it open. It peels open like a banana peel. And then at this point, I recommend pulling back on the plunger until you meet the dose that you're prescribed to by your provider. So for the sake of this video, we will use 150 units. So I pulled back 150 units of air and take off the cap. Insert it into the rubber stopper. Inject your air in, flip it over, and pull back to 150. If you get a little bit of air in the syringe, that's okay. You can push it back up and restart. So go back until you see 150. You can see I have it here. And then take out your needle. Now we want to go ahead and prep the site for injection. This is a subcutaneous injection, so pinching an inch of belly fat or pinching an inch of skin on the thigh are both appropriate areas for this injection. So once you've chosen your site, you will take an alcohol prep pad, clean the site off, let it dry, and then you will pinch that inch of skin and go in fast at 90 degrees like a dart. And then push the plunger, hold it for a few seconds, then take the needle out. You can get rid of the needle into your red sharps container, and you've completed the injection. Okay, so that was the Gonolf multi-dose vial. Essentially what you're doing is you're hanging on to that vial after you've reconstituted it, pulling up your dose each day from that same vial. So be sure that you're not throwing that vial away after one time. You should have multiple doses within that vial. So be sure to hang on to it. Like I said, you'll continue to pull up each day's dose out of there until the vial is completely empty. At that point, if you are not done with your stimulation cycle, you'll do the same thing over again. So open up a new multi-dose vial, reconstitute it, and then you're all set to start over again with that. Okay. You may hear that the Gonolf also comes in another form of the pre-filled pen. So that's not uncommon that you'll kind of hear about both of these forms. We do have videos about the pen on the PharmAssist page. So if you're interested, you can always find it there as well. Okay. Now with that, do we have any questions rolling in quite yet, Tony?
So the first question we have, what are the benefits of the multi-dose vial over using the Gonolf pen?
Yeah, so I think ultimately this is probably a personal preference thing. So it's the same medication. It's going to have the same effect on your cycle. First things first, I would check with your clinic. See if they have a strong preference for one modality over the other. If they don't, then, you can, like I said, you can watch those videos on the PharmAssist page, see if one, kind of speaks to you more than the other, if one seems easier than the other. They're both subcutaneous in the belly or that outer thigh. So same size needle, same medication, it's just a different way of giving it. So if you have a personal preference on that level, or maybe there's a cost difference that I'm not as privy to, but Mandel's would certainly be able to give you those prices. So that would be something else I would maybe check out if you are trying to decide between the two modalities. Great question.
Awesome. So another question that we're getting, how can I find out if it's better to buy my meds through insurance or out of pocket? Which is a question we get a lot down here in Louisiana.
Yes.
So that's a great question.
Yeah, these, we want to, get the most bang for our buck at the end of the day. So I would suggest price comparing the two. So usually in order to do this is, I know that Mandel's can certainly give you an out-of-pocket quote for the medications, and then they can also try to run your insurance. If they're able to fill for your insurance, then they can give you that quote with insurance coverage. If they aren't able to fill through your insurance and give that price quote with coverage, then they can direct you probably to the correct specialty pharmacy. So a lot of times insurances will have preferred specialty pharmacies in order to utilize your benefits. So if that's the case, they can refer you over there, and then that pharmacy should be able to give you the quote, and then you can decide which is best for you, whether it be out of pocket or utilizing your insurance, and compare those quotes directly. Tony, do you have any other tips on this one?
Yeah, we kind of know here, like which insurance companies probably are gonna, some of them just unfortunately have higher copays than just some of the specialty pricing. I do get a lot of patients that say they have like friends with a pharmacist that's not specialty, not fertility related. And I try to advise them that I'll be happy to send the prescriptions to you, but if they just don't have those special pricing with the manufacturers, it's usually still very, very high. So that's a big question I've been getting. I've gotten that a couple of times in the last few months, actually.
Yeah, I agree with you. I'm always willing to try, and getting the numbers straight from the pharmacy seems to be, the best route at the end of the day. But definitely going the extra mile, I think, to compare the two is worth it for most patients.
Yeah, I think once they see that there's just, it helps when they can. It helps when you can see. I mean, you don't know. You think you have insurance coverage, so then you see the specialty pharmacy compared to your insurance, and then kind of realize that I'm going to just go with that specialty pricing.
Yeah, definitely, I agree with you there. Great.
So one of our next questions: what should I do if I miscounted or accidentally inject too much of the gonal from the vial?
Yeah, so certainly first and foremost, let your clinic know, and try to know, how much you actually gave yourself. So do that math. They may want to alter either another dose of this medication, or maybe they have you on a duo of two different ones, the Gonolf and another type of FSH. So they may want to adjust that dose, to make up for the difference. Some may just say it's fine, continue your typical doses, but at the very, very least, definitely let your clinic know. I think that they would at least want to note it on their end, so that they have that information when they're reviewing your cycle outcomes at the end and so forth. So that would be one that at the end of the day would be up to your provider or your nurse of what they want you to do, if they want you to make adjustments, but certainly let them know so that they can best guide you. At the end of the day, it's probably not going to make or break your cycle, but just, be super transparent with them. It's super important so that they can adjust things as needed to get you the best outcome for your cycle. Great question.
Yes, I agree. Great question. I don't see anything else on the gonal right now, but if there's anything else you want to add while we're getting ready for the second video, and just everyone that's watching know that if you do have a question that comes up, and you can always ask it. It doesn't have to be on that certain medication, or it can just be a general fertility question as well.
Yes, definitely. We are open to any and all questions. So don't be shy, send them on in, and we can certainly tackle them as we go. So now one question that I do get on PharmAssist often is, what is the Gonolf doing? Why am I taking this medication? What's the purpose? It's follicle stimulating hormone, or FSH is how you might hear it as well. It's quite literally stimulating the growth of the follicles within the ovaries, and within follicles are eggs. So at the end of the day, at the end of the cycle, our goal is to yield as many eggs as we can safely. So this is mimicking, what our bodies do naturally in a natural cycle, where we're sending out FSH hormone to recruit one follicle. We are overriding that, giving higher doses of FSH so that we can get as many follicles as we possibly can. So definitely important to take this consistently every day so that we're encouraging that continuous growth throughout the cycle. Any other questions?
We actually do have a question. It's a good one on where to inject. So is there any way to be sure we went into the sub-Q tissue?
Yeah, so really, honestly, anywhere you can kind of pinch an inch is fair game, is what I always say. So if you can pinch up that tissue, then you know that you're getting into that adipose or fatty tissue is the goal. So again, like I said, the belly and the outer thighs seem to be the easiest if you're doing it to yourself, but also the back of the arm is another good option. If you have your partner, a friend, family member that wants to be your honorary home health nurse and give you your injections, then that may be another good option. But like I said, anywhere that you can pinch up an inch of tissue, then you know that you have that fatty tissue there at the surface.
All right, I think that's all the questions we have on gonal. So I'm going to go ahead and get ready to start the HCG video.
Now I'm going to show you how to prepare and inject an HCG trigger shot. So first, I recommend gathering all of your supplies. You will need an alcohol prep pad, your medication. It should come in powder form. You can see a little bit of the powder there. your bottle of diluent, so saline or sterile water. And then you will need your injection needle. So this will be a 3 ml syringe with a 1.5 inch needle attached to it. So to start, I recommend taking off all of your caps. So there will be a cap on your powder that'll just snap off, and same thing with your diluent. Next, you can open up your syringe. So it'll peel open like a banana peel. This comes out. Then I would go ahead and draw back the amount of air that you're planning to pull up of diluent. So this can vary from practice to practice. At my practice that I work at, we recommend mixing with 1.5 mLs of the diluent. So I'm going to pull mine back to 1.5. Take off your cap. Then you're going to insert your needle into your vial, push all of the air in, flip it over, and you'll kind of feel the plunger naturally pull back on its own. Make sure that your needle, and I'll turn it here, is in the actual liquid and not pressed up like this. Otherwise, you're only going to draw back air. So make sure you pull it down some and pull back until you have roughly 1.5 or whatever your provider recommends. Now you can see there I have a little bit of air in the top of my syringe here. You can actually push everything back up and start over. It won't hurt anything. So I'm going to pull back here. I have roughly 1.5. So now I can take this out. Now I'm ready to reconstitute my powder. So you have your powder vial. You see the rubber stopper here. The needle just goes right into there. Push saline in. And then give it a good little swirl. Helps things dissolve, but typically the powder dissolves just about instantly. Then you can flip it over. Again, make sure you pull the needle down so it's within your liquid. You can pull everything back. Now you're going to have roughly the amount of fluid that you put in. Some of it does get displaced when it is dissolving the powder, and that's okay. The most important part here is to make sure you get all of the liquid out of that vial. Once you have that, you now have your dose. Can take the needle out of the syringe, and now you're ready to prepare the skin site. So this is an intramuscular injection, so different from the subcutaneous injections you've likely done up to this point in your cycle. I usually recommend doing the upper outer quadrant of the buttock, so it's almost like the hip area, in order to do this injection. So at this time, you can take your prep pad, clean off the skin site, let it dry, and then you actually want to pull the skin kind of taut when you do this to be sure that the medication gets to the muscle. When you're ready to inject, you go in fast, 90 degrees like a dart, and then push your plunger in. Take it out here, and you're all done. Okay, so as you could see, definitely a different size needle for the HCG trigger shot compared to our Gonolf, and that's because it's that intramuscular injection. So when you're kind of looking at the skin and below, you know, we have our top layer of our skin, what we see here on the outside. Then below that is that fatty or adipose tissue. So that's our goal for our subcutaneous injections, like our Gonolf that we just reviewed. Then even more so below that, we have the muscle. And so that's the reasoning that the needle is the size that it is. It's because we have to make sure that we get through the top couple layers to really get to the muscle for absorption. So you know, it doesn't take much to see the difference in the sizes of the needles, but it's for a good purpose. Okay. Any questions quite yet, Tony?
Yeah, we do have a few questions. I wanted to comment on that as well. I was going to say in our office, we get a lot of patients that want to get a smaller needle, or they're just too afraid that that needle is just too long. And it's important, you know, to try to explain, like, I know it looks intimidating, but you want to get through those first few layers of skin into the muscle, and it actually looks a lot worse than it is. And teach the same way, like inject it hard and fast like a dart, and the faster it goes in, the less painful. I know a lot of partners get nervous, they're gonna hurt somebody, so they wanna try to do it slow, and I'm like, you're really just making it a little bit worse. So fast and hard, and it needs to be long to get through the muscle. If they're really thin, then we will sometimes do the 1 inch, but most IMs are gonna be the 1.5 inch long. So we have a question about if a hot or cold pack is needed before or after. And is this information provided with the protocol of medication? So that's a good one.
Yeah, so I usually recommend for the HCG to do ice if you're going to do anything. And that's just because it can kind of numb that top part of the skin. But like Tony said, if you're going fast and quick, I think that, the ice might be more work than it's worth at the end of the day, but it can help kind of take that initial kind of pinch off of the first part of the injection.
In a timing question we have, how do you know the exact moment that I need to take my HCG?
Yeah, so your clinic will most certainly tell you an exact time to take this. And when they tell you that time, they mean like right on the dot. And the reasoning is this trigger injection is essentially triggering ovulation. And so especially during an IVF cycle, we are timing up this injection with your egg retrieval procedure. So, we make the body think that it's going to ovulate all the eggs away like it would in a typical menstrual cycle. However, we are going to sneak in right before and actually aspirate or drain the fluid out of the follicles in hopes that those eggs come with them. So during your IVF cycle, when the follicles are developing within the ovaries, the eggs are actually attached to the wall. So if this is your follicle growing, the egg is attached to the wall of this follicle. As it grows and grows and grows, it stays on the wall. What this trigger shot helps to do in a step towards ovulation is it actually causes the egg to release so that it's kind of free floating in the follicle before it leaves the follicle. So we go in right at that perfect time where it's been released from the wall, but it hasn't left yet, so that we can keep all of the eggs for ourselves. Up until this point in your cycle with your other medications, we certainly want you to keep them consistent, but this is the most important one to take exactly on the time that your clinic tells you to take it.
So this is a funny question, not funny, but a good question that I also get a lot of people being, we tell people to do their injections at night, and some people work at night and some people go out to dinner at night. So I'm due to give my HCG the last day we're visiting nearby family. Is that a good idea, or should I definitely be at home?
Yes, I get similar questions a lot. So, this is perfectly fine from a clinical standpoint, but ultimately it's whatever you're comfortable with, right? So if it's going to cause you a lot of stress and nerves to have to, sneak away and do this injection, maybe you're sharing your journey with your family, maybe you're not. So those are all things that you need to take into consideration. But, in terms of a medical standpoint, I'm okay with that as long as you remember to do it at the time we tell you. So if you think that you can, meet that goal and do it right at the time we tell you, and you can sneak away from whatever you're doing, with family, then that's fine. But ultimately that's something that, you should be comfortable with at the end of the day, because this is such an important injection and you've come so far in your cycle to get to this point that I want you to be comfortable and confident to do the injection when the time comes. So that's something that I would definitely kind of reflect on and see what you are most comfortable with.
I definitely agree. I know it's always kind of hard if you're not telling friends and family to, try to figure out, how am I going to sneak this shot in? The next question we have is, what is the biggest risk of missing my HCG shot?
Yeah, I think that, ultimately the biggest risk at the end of the day is that, you don't get any exit retrieval, whether that be they've already ovulated and they've left the ovary, or the timing is the opposite way in that it's still stuck to the follicle wall. So either it was done way too early, way too late. So I would definitely, check in with your clinic before your cycle and see, in the event that you forget or, it's off, what's their threshold for how off the timing can be? Are they okay with 10 minutes? Are they okay with 30 minutes? If you're over a certain amount of time, do they just want you to not take it, by the time you remember? What do they prefer? So that, you can ultimately get the best yield of eggs at the end of the day. Good question and a common question.
Yeah, that's a good question. I know when I'm doing injection teaching at the office, we definitely stress with the trigger, set a bunch of alarms, however you have to do it to get it done. If you want to mix it, I know a lot of people get nervous about mixing it. So you can mix the trigger shot if you want to start 15 minutes early and get it mixed and have it all ready and pulled up. And then as soon as the alarm goes off, you can just inject it, so you don't have to worry about fumbling with the vial. But you can always call the provider too if you have any issues with mixing it in that moment. I know one of our nurse practitioners was really good. Sometimes she'd even jump on FaceTime with people. So we all know at the office how stressful that time is, and the trigger shot especially. It's definitely a very, very highly timed injection. So
absolutely.
So I don't have any more questions on HCG right now. If anybody has anything else they think of, again, you can put it in the chat box for us, and we'll definitely get to the question. Anything else you want to add on that, or are you ready? I can just queue up the next video.
Yeah, I have just a few more. So same as you mentioned, Tony, whatever works best for you in terms of setting an alarm, using these home devices. We have these Alexas and so forth around that are here to help. So, definitely work smarter, not harder. Another thing, especially with the intramuscular injections, is we sometimes offer to draw circles on kind of that upper outer quadrant of the buttock when our patients are in office. So it's one less thing you have to think of. So just like Tony was saying, mix all that up, have it ready to go 10 to 15 minutes before. That way, when the clock hits, all you have to think about is actually doing the injection. If you have kind of a circle there, we call it a bullseye or a target. It's, again, one less thing you have to think about. You're doing it in the right spot. So at that point, it's just physically putting in the needle and pushing your plunger. So that's, another tip that we like to use. And I'm sure that clinics, across the country utilize it or would be willing to. So that's just another tip for these intramuscular ones. Other than that, I think I'm ready to move on to the last one. Now I'm going to show you how to do a progesterone and oil intramuscular injection. First, I recommend collecting all the supplies that you need to do the injection. So first and foremost, of course, you need your progesterone and oil medication. So collect that vial. Next, you will need a syringe and needle. Typically, it's a 3 ml syringe that's used. A lot of times they will come with needles attached onto them. For the sake of this video, my practice uses the 22 gauge needle to inject and an 18 gauge needle to mix. I recommend talking to your provider about what they prefer you do for your treatment. So here I have the 3 ml syringe with a 22 gauge 1.5 inch needle. So then I also have a 1 inch 18 gauge needle to mix. You will also need your alcohol prep pad. So at this point, go ahead and take the cap off of your progesterone and oil. It just snaps off here. You'll see the rubber stopper on top. Then open up your syringe that has the needle attached. It'll peel open like a banana peel. And then you can open up your needle that you'll use to mix. Now, if your provider wants you to use the same needle to mix and administer, you won't need to do this step. So that second needle opens up like a banana peel as well. I recommend avoiding touching the top of this cap here and keeping that sterile. Then if you twist, your other needle will come off. You can set that down to use later. Then this needle will twist on. If you twist to the right, then you can remove the cap. And again, at my practice, we typically have doses of 1 ml. So for the sake of the video, that's what I'm going to use, but I would confirm this with your healthcare provider. So I recommend drawing back to the number that you will use to administer. And what I mean by that is if I'm using 1 ml, I'm drawing back right now 1 ml of air. So you can see my plunger is right at that 1 ml mark. Then you will take your vial and the needle goes right into that rubber stopper. Then push your air in, flip the vial over, pull your needle down slightly to be sure it's in the liquid and pull back, and you'll see the medication pull back into your syringe. And it is oil, so it's a little thicker, so it might take a little bit of help of you pulling down on the syringe. Now, if you have some air, that's okay. You can push back up and start over. That's perfectly fine. So like I said, I'm using 1 ml for this video, so I have 1 ml of the oil here. Take this out. So now I'm ready to administer. I do not recommend administering an intramuscular injection with an 18 gauge needle, which is why I saved my 22 gauge needle here. So this will twist off, put it directly into your sharp spin. No need to recap it. And you'll twist on your needle to inject. So now we are ready. It's time to prep our injection site. For the sake of the video, this is going to be my skin and my muscle. When you're doing it at home, I would confirm with your healthcare provider if they have a preference of a site for intramuscular injections. I typically recommend using the upper outer quadrant of the buttocks, so it's almost like your hip area to do the injection. So once you have chosen your injection site, open your alcohol prep pad, clean the site with alcohol, let it dry completely. Take the cap off of your syringe, and then you're actually going to kind of pull the skin taut, and then you will inject quickly, fast like a dart at 90 degrees. Fast there, all the way to the hub, and then press the oil in. Now it is thick, so it can take a moment to go in. Typically in skin, it's a little quicker than my cube here. Once the injection is in, you take your needle out. There might be a little bit of oil that comes out of the site, and that's okay. You can just wipe it up with some sterile gauze, and then you can recap your needle, put it into your sharps container. You're done. Now, one thing I like to mention with the progesterone and oil, especially because a lot of times when patients are taking this, it's for extended periods of time, weeks on end. So the oil can actually kind of collect if you're not active and moving after you do the injection. So the worst thing you can do is go back to bed, wake up in the morning, do the injection, go back to bed and let it sit. I recommend massaging the area. You can take like a tennis ball or a lacrosse ball and kind of knead on the area as well. Heat can help disperse the oil as well. Just if you use the heating pad, be very, very careful that you pay attention, only use it for small amounts of time. And then being active, so walking around, going for a walk, things like that can help to disperse the oil into the muscle as well. Okay, so like I said, you know, this is similar to the HCG injection in that it's an intramuscular injection. So the actual injection itself is very similar, but this is it's mixed in the oil, so that's a little bit different. It's a little bit thicker, and then most patients are on it for an extended amount of time, whereas your HCG is usually a one-time deal for your trigger shot. So same type of injection, just different purposes, different medications, and a little bit different in the thickness of the liquid itself. Okay. With that, I am ready for questions if we have any quite yet.
Yes, we do have a question coming in. This is a pretty good one. Everyone's a little nervous of the progesterone injections. I feel like people come in at their new patient consult asking about these because they've already read about them. So is there anything I can do to make the injection hurt less? Can I use Emla cream?
Yeah, absolutely. You can certainly use Emla cream. So those that don't know what that is, it's like a topical numbing cream that you can put on the site before you do the injection. Another option is there's Sanera patches is the brand. So it's a numbing patch that you can apply directly to the site 20 to 30 minutes before the injection. Same idea, it numbs that area. We actually have videos on Sanera on the PharmAssist page as well. So if you're interested in seeing that and how it differs from just a topical cream, you can definitely check that out on the pre-recorded page. That, and then, aside from just the actual injection, itself, same thing, in fast 90 degrees like a dart, the quicker the better. Also rotating sides if you're doing it daily or however often you're doing it. So not doing it in the same exact spot every single day. Rotate sides of the hips, that can help as well.
Yeah, I like how you said in your video, like massaging with the tennis ball and just like massaging after and moving, because that's one of the biggest complaints that we get is like little knots that form under the skin. And then they get kind of tender. And then sometimes they think that might be they're allergic to the medication. So that kind of brings to the next question, like what is what is an allergic reaction with progesterone and oil?
Yeah, so, like you were saying, Tony, it's normal to get these, small kind of, they almost feel like little like hard balls under the skin where it kind of collects there. And am I allergic? Am I not? Is this just a small reaction? So, certainly if you're getting like hive type reaction, so a rash and it's spreading, if you have any trouble breathing, swallowing, that's a medical emergency. Okay. So you need to seek help from your clinic or an emergency room, if they're not open. So first and foremost, if you have any trouble breathing or swallowing, that's first and foremost, number one. Get medical attention right away. Now, there can be localized irritation with the progesterone and oil, so a little bit different. Very normal to get almost like a small little redness rash in the area, especially after some time has passed of being on them. So usually that's not something that I get complaints of early on. It's usually towards the back end after that skin has become a little more irritated from the frequency of the injections. So I would say that's considered normal. We're okay with using like an over-the-counter hydrocortisone or something like that to help, but definitely confirm that with your clinic that they're okay with something like that, just to help ease with that, because it can cause some itching as well. All those are unfortunately normal with this injection. I have some patients that try the progesterone and oil mixed with ethyl oleate. It's just a different kind of oil suspension. I get mixed reviews on that, if that truly helps with the irritation, or if it's just the fact that, you're on these injections for a long time. So over time, you become more sensitive with it. But definitely a localized kind of rash or redness is considered normal with these.
And sometimes, just to add on that, it might be a good idea to check in with your provider's office, because I've had patients come in and they're like, I have this rash, it's all red. And I'm like, well, you're coming in, let's take a look at it. And they're actually not injecting in the right spot. They're so far over. So it's really important to get in that upper outer quadrant of the butt muscles. Because the closer in you get, it's not really muscle. So you're getting, right into the tissue, which causes a lot of irritation.
Definitely. Good tip.
This is a good question. What does progesterone and oil actually do for my cycle?
Yes, so this one we are actually replacing what our bodies would do in a natural cycle. So typically in a spontaneous pregnancy, after the egg has ovulated from the follicle, fertilized and planted, and there's a pregnancy there, left over is that collapsing follicle, and it's called a corpus luteum, and that actually produces progesterone to support the pregnancy. So in medicated embryo transfer cycles, we most times don't have that corpus luteum to produce that progesterone. So we have to mimic it and replace it until the placenta takes over later on in the first trimester of pregnancy. So that's the importance. And and I refer to this stuff as liquid gold. You absolutely need that progesterone supplementation to sustain pregnancy. So it's super important to, as much as this causes that tenderness. And like Tony mentioned earlier, everyone knows about these, prior to even starting a cycle, and there's a reason for that, but they're just so, so important. So, utilizing that massage, the numbing and so forth is crucial, because these injections truly do carry on that pregnancy until the placenta can take over.
And then there's a question about, I guess, if referring to the EMLA cream, if you would use an alcohol wipe prior to putting the cream on.
I don't think it's necessary. I think you can go ahead and apply the cream, and then right before injection, still do your alcohol pad as normal. At that point, the cream should have already soaked in to the skin and is kind of already doing its job. So the alcohol pad shouldn't have any ill effect on that. Do you agree, Tony, in your experience?
Yeah, I would say probably before or after. I think, I would definitely wipe at some point before you inject. And then a big thing you said earlier about rotating the sides, that will help a lot with pain management during these. And then I always tell patients, if like one side, I personally did these shots, so I know the pain everybody's going through with these. One side sometimes just gets worse than the other, and just maybe give that side a break for a while and then just continue to inject. We get that question a lot, if you have to rotate sides. So I would say, no, you do not have to. Would you agree with that, Kaitlyn?
Yeah, absolutely. Listen to your body, right? It's like, don't fix it if it's not broken. Yeah.
And you can also try your thigh. I don't personally recommend it, but I know that, sometimes people have success in doing like their upper outer thigh. So if that's something, your clinic can show you exactly where to inject that. I don't see anything else. Do you have anything else to add on progesterone?
I don't think so. I agree with you there, though. The thigh is definitely an option. It's not my first option. I think it's probably going to be a little more painful and tender than, the glute muscles. But ultimately, it may not be a bad idea to give it a try if you're really having, severe discomfort. So I agree.
Right. Well, I guess that's all the questions we have. So I'd say we're going to wrap up. I just want to thank you again, Kaitlyn, for your time tonight. The purpose of our program, of course, is to ask questions here in a comfortable space. Thanks to all our listeners on Zoom and Facebook and sharing your excellent questions. We hope that you were able to learn something. Even if you didn't learn something, we hope we answered something for you. And then also don't forget that these virtual learning experience videos, as well as the demo videos, are on our YouTube and Facebook page and at the My Mandel's Pharmacy page. We believe that repetition leads to retention. So it will help you just to watch these over and over. And we look forward to seeing you guys here again next Monday at 7 p.m. Eastern. And then please share this program with anyone you feel that can benefit from it. A friend, a colleague, a family member. It's a great opportunity for them to get comfortable with these injections. So thank you guys. Thank you, Kaitlyn, and have a good evening.
Bye, everyone. Thank you.